Following a myocardial infarction, there are many important steps in the healing process. From revascularization, to medications, to cardiac rehab, to patient education, all of these facets play an important role in optimal recovery. Most patients do not die with a myocardial infarction. Most patients recover and go on to achieve and sustain an active lifestyle. Following a myocardial infarction, it is very important that patients stop using all tobacco products. The use of tobacco products, predominantly cigarettes, cause not only the vessels to constrict, but also cause the platelets to be more active and more likely to stick together. This leads not only to more symptoms following a heart attack, but also higher risks of recurrent heart attacks and other vascular problems. The state of Mississippi has provided a statewide program available through 1-800-QUIT-NOW to enable and enhance the smoking cessation rates and improve the numbers of people who are actually able to stop using tobacco products. At the time of discharge, patients' medication regimens almost always include blood thinners. Blood thinners are an important part of medical therapy following a heart attack, following bypass surgery, and following revascularization, including the use of coronary stents. Following stent implantation, we almost always use dual antiplatelet therapy, which includes aspirin and a second drug, either Plavix or Brilinta. These medications in combination are very effective at preventing the platelets from sticking to the blood vessel and also from sticking to the stent. Patients are often discharged from the hospital with sublingual nitroglycerin. Nitroglycerin is a medication which relaxes the vessels on the surface of the heart. When patients have symptoms of a heart attack or chest pain syndrome, nitroglycerin will often lessen or alleviate these symptoms. We recommend patients use nitroglycerin anytime that they have recurrent discomfort that reminds them of their heart attack or the symptoms that brought them to the hospital. At time of hospital discharge, we often recommend early follow-up, usually within 1 week. The reason this is important is to make sure that patients are taking all medications, understand their medications, and have an early chance to ask questions. One of the most important treatment options and treatment regimens following a heart attack is education, because the more a patient understands, the more compliant they will be and the better they will do. Cardiac rehabilitation is an important step in the recovery process. Cardiac rehab allows patients to exercise following a myocardial infarction or revascularization in a supervised setting with cardiovascular and rehabilitation specialists.
Committing to a healthy lifestyle doesn't happen overnight, but gradual changes can lead to better health. Learn how to apply SMART goals, the benefits of exercise for your mind and health, and how to stay motivated. Coming up next.
Choosing to make healthy changes to your everyday lifestyle habits can lead to better overall health. But making lifestyle changes takes time. You're trying to change habits you've lived with for years. Many forces shape our everyday habits. Our own personalities, our families and friends, how we're raised, where we live, our jobs and income. And all of those factors are too powerful for us to change our behaviors overnight. The promises of fast, instant change to a better, healthier lifestyle are out there. You see them every day. 2 minutes a day will change your life. If you don't see results, we'll send you your money back. And they may be tempting. We live in a world where we expect instant results. I'll lose 20 pounds in a month. I'll quit smoking cold turkey. And when we don't get quick results, we get frustrated and give up. These are not the kinds of lifestyle changes that will result in lifelong success. They may work for a couple of days, But sooner or later, something will come up, an obstacle that will challenge your ability to keep with it, and you'll slip back into your old, comfortable habits. Instead, small, gradual changes to your everyday habits can lead to lifelong changes that will have a positive effect on your health. Take it one step at a time. The first step is to recognize that a change is needed, that whatever you've been doing in the past isn't how you want to continue. To recognize that is really a great place to begin. Then, if you're committed to making a change now, make a plan that includes both long-term goals and short-term goals. Small, doable goals that will lead to success. Make sure you take some time to think about the obstacles that may get in your way and how you will deal with them. Having a plan B can help you continue to reach your goals while avoiding a setback. Remember, when making a healthy lifestyle change that will last, follow these steps for success. Recognize a change needs to be made. Commit to making a change. Make a plan that includes long-term and short-term goals. Think about obstacles and how to deal with them. And when you feel tempted by quick, overnight methods that promise instant change, remember, they usually don't work. Healthy, permanent changes take time.
You're watching the Baptist Stroke and Heart Care channel. The best investment you can make in your future is in your health. And one of the best ways to maintain and even improve your health is to include exercise in your daily routine. Exercise can speed up your metabolism. Metabolism is the process your body goes through as it changes the calories in the food you eat into the fuel your body needs to function. Metabolism is complicated, but putting it in simple terms, people with a faster metabolism tend to burn more calories than people with a slower metabolism. Everyone's metabolism is different, and as you age, your metabolism can slow down. But no matter how old you are, exercise can help speed up your metabolism, helping you maintain a healthy weight and, when combined with healthy food choices, to lose weight. Not only will you burn calories directly from the exercise you do, but your body will also be able to burn calories more easily all the time, even when at rest. Exercise also strengthens your heart and lungs. Your heart is a muscle, and like any other muscle, exercise can make it stronger. A healthy heart can help to improve your body's overall circulation and reduces your risks of heart disease, vascular disease, stroke, and lung disease. Cardiovascular training is the best way to get your heart pumping faster. Try walking, jogging, or swimming to get your heart rate up. As you age, the amount of both muscle and bone mass in your body naturally decreases. Exercise, however, can prevent or delay this process. Maintaining strong muscles can protect your body from injury. And maintaining strong bones can delay or prevent osteoporosis, a common bone disease. Together, strong muscles and bones can help make everyday activities easier and help prevent minor injuries from becoming more serious. Make sure you drink plenty of water before, during, and after you exercise. Staying hydrated will help your body during exercise and in the recovery afterward. And finally, regular exercise can also reduce stress and improve your mental health. Many types of exercise release endorphins, a chemical produced by your body that makes you feel happy. This can reduce stress and give you a more positive outlook on life. A session of stretching can help you relax and unwind. Exercise can also help you fall asleep and stay asleep. Sleep can be a key factor in a positive mood, as well as providing many other health benefits. And regular exercise can help you feel better about how you look, improving your overall self-esteem and confidence. You are your most important investment. Choose to invest in yourself with an exercise plan. With regular effort, the payoff is powerful. A healthier metabolism, stronger heart and lungs, better muscle and bone strength, a happier and more relaxed you. You are worth it.
Time now for a Health for Life Minute.
Most of us know we have to lower our salt intake, and there are a variety of ways to add flavor without sodium. Some tips: sautéed onions can flavor up a chicken dish, and adding garlic to foods really boosts the flavor. Onion powder and garlic powder can be used, and don't forget pepper, red pepper, white pepper, black pepper. All different varieties can spice up the food in a low sodium way. Be careful about salt substitutes. Always speak with your doctor before you use them, because they may contain potassium chloride, which can be harmful to people with certain medical conditions. Also, take the salt shaker off the table and eliminate or certainly reduce the amount of prepared or packaged foods. For more low-salt options, visit the American Heart Association website, heart.org.
No matter how old you are, no matter how long it's been since your last workout, your body will benefit from exercise. But starting an exercise plan, especially if you haven't been active in a while, can be overwhelming. For best results, make your goals SMART. SMART stands for specific, measurable, attainable, realistic, and timely. And setting SMART goals will help you take the idea of exercise and turn it into action. First, be specific. How many times in your life have you thought you are ready to exercise more and made that your goal? How did it go? The idea is great, but without a clear goal, you probably felt frustrated because there was never really anything to reach. Instead, make a goal that is specific. Do you plan to walk 3 times a week? Maybe you want to focus on calories burned and plan to burn 900 calories a week through exercise. Or maybe you'd like to run 1 mile without stopping to walk. Whatever goal you set, make it specific so you know what you have to do to reach it. To easily find out if you have reached your goal, it must be measurable. Did you walk 3 times this week? Did you burn the number of calories you wanted? Did you run for 1 mile without stopping? Is your goal attainable? In other words, can you reach that goal? It is important to set goals that are not too easy, because where's the challenge in that? And not too difficult, because then you will get frustrated and give up. For example, deciding to run a marathon when you haven't run in years may not be attainable at this point. Try running a mile first, and then gradually increase the amount you run each time. If a marathon is your long-term goal, you will get there over time. Trying to bench press 200 pounds the first time you add resistance exercises to your exercise routine may not only be hard to achieve, but may also cause injury. Instead, think of a goal that is attainable and work towards it safely. Each goal you set should also be realistic for you. With your busy schedule, can you walk in your neighborhood 5 nights a week? Maybe 3 nights a week, and once at lunch is more realistic for now. If you have a medical condition, meet with your healthcare provider or personal trainer to ensure your goals won't increase your risk of injury or make your condition worse. Exercise is for the long term, so do it safely.
When I was 350 pounds, I just would walk for 5 to maybe 7 minutes. And that would be enough to where I was sore, I was winded, and I just couldn't do any more. But I would get up every day and I would continue to do that. And after maybe a month, I noticed that I was doing twice as much. After 2 months, I noticed I was doing maybe 4 times as much.
And finally, every goal you set should be timely. Set an end date and schedule it into your daily routine. Without a time frame to reach each goal, you may never get there. I will walk 30 minutes 3 times this week. I will do 1 set of repetitions for each muscle group this week. I will join a water aerobics class before my birthday. Starting an exercise plan can be difficult, but seeing results can give you the motivation you need to keep moving. Make your goals SMART, specific, measurable, attainable, realistic, and timely. And you will have a plan that fits your life.
Babe, she should have been home by now.
Well, you know, when they go out and have fun, first thing you do is forget the time.
She was supposed to be home.
Yeah, it's only,
Exactly, it's 10:45. I think that's her.
What are you still doing up, sweetie?
He said he'd have you home by 10, Mom.
Now you know how I felt.
Everyone has a reason to live a healthier, longer life. What's yours?
In the first few days and weeks of beginning an exercise routine, you begin to notice the health benefits and just feel great. But as the weeks progress, you may start to feel your motivation slipping. For many different reasons, it may be difficult to keep exercise part of your daily routine. But exercise is for life. You won't see long-term results if you give up. So it is key to stay motivated. First, take a look at your goals. Are they realistic and achievable? Or do they make you feel frustrated and overwhelmed? If you feel like you are not reaching your goals, it may be time to reevaluate and change your plan. It's okay to make changes to your goals, especially if it helps you achieve them. But remember, even small victories are reason to feel good about yourself. Next, are you having fun? It's important to choose an activity you enjoy, because the more you enjoy it, the easier it will be to make it a routine. Try listening to music or books on tape, or watching your favorite TV show while you exercise. Maybe it's time to change where you exercise. If you usually walk on the treadmill, try walking in your neighborhood. Who knows? You may even walk a little further without realizing it. Or maybe you need to change it up a bit. You wouldn't want to eat the same meal for dinner every night. Why would you want to do the same workout every day? Try introducing new types of exercise into your routine to beat the boredom. Invite a friend or family member to exercise with you to encourage each other.
I have a friend, Larry. He has a Fitbit, and he sent me an email one day saying, let's have a challenge, how many steps we can do in a week. So I kind of increased my steps.
The support from family and friends is great. But if you are still having a hard time, you may want to meet with a personal trainer or your healthcare provider. They can suggest ways to make your workout less like work and more like fun. Many people find it helpful to keep a log. You can keep a log on your computer, tablet, or notepad. Keep track of when you were active, what you did, for how long, and how you felt afterward. This log will help you see your progress. And when you see how far you've come, you'll want to keep going. Fitness trackers are also a great way to keep track of your successes. Many can send you alerts when you meet a personal goal, an excellent way to stay motivated.
It's wonderful when I get to 10,000 steps and it vibrates in my arm. It's like celebration time.
When you do reach a goal, reward yourself. Give yourself a healthy reward, like a new book or new running shoes. And finally, be flexible. If you do miss your exercise session for any reason, don't think of it as a failure. Sometimes life does get in the way. Just get back to working out as soon as you can. Exercise is good for you, but staying motivated can be difficult. Remember to take a look at your goals and make a change if you need to. Make exercise fun. Find support. Track your activity. Reward yourself. And be flexible. You are doing great things for your body and your health. Keep it up.
Time now for a Health for Life Minute.
Out of breath when you first begin to exercise? Just like a car engine, it takes a little time after startup for your body's equipment to operate at peak efficiency. In a few minutes, your increased heart rate and breathing rate will enable you to better transport oxygen to your active muscles. So as you warm up and your body makes the transition to a more efficient use of oxygen, you will feel more comfortable. And as you continue to exercise daily and to become more fit, you'll breathe more easily for an extended aerobic period.
The battle of the burgers really doesn't have to be a food fight, especially when you've got a delicious burger. Even though the regular burger is 700 calories, and this one here is 300 calories, 43 grams of fat, 4 grams of fat. Get on with it, Graham. Here is an onion finely chopped, and in the bottom of a pan over a teaspoonful of oil. And I want to put on 1 tablespoonful of curry powder, a mild, good curry powder, stirred in well and truly, kept on the heat for about 3 or 4 minutes. It's going to look like that. All right. So then take it to a food processor, just drop that in. That's the savory base, wonderful flavor. Then some raisins, 4 tablespoons. This makes 4, by the way. Just put in there, and they're just going to give the sweet taste. A couple of tablespoons full of parsley, a little herbal taste. A tablespoonful of fresh lemon juice. Gives that sweet sour balance to it. And then a 14.5 ounce can of kidney beans, well drained and washed. Throw those at the top. Now good plant protein into there as well. Only takes just a couple of minutes to, well, moments really, to whiz it round. There, good. And then lift out to the top. And here I've got 1 cupful of brown rice, and that's just been cooked perfectly. And then take the rest of this mix here and massage that in together. Don't put the rice into the food processor. It'll really mess it up. Okay, now form it into a patty, just the right size, and cook that off until it's just perfect. It browns beautifully, so aromatic. Little dusting of pepper, little dusting of salt over the top of the tomato, and then lift the tomato, sandwich it together, and you're ready for your burger. Say taste of health.
Sitting for long periods of time increases your risk of developing many serious health problems like heart disease, type 2 diabetes, and some cancers. Many healthcare providers agree. Sitting is the new smoking. This means that sitting all day, every day, can be as dangerous to your health as smoking. Even if you do exercise on a regular basis, you are still probably sitting too much every day. Many people start the day off sitting in their car on their commute to work, then sit at a desk in front of a computer, and then sit in front of a TV in the evenings. Too much sitting. Instead, find ways each day to take an energy break. Schedule movement throughout your day on top of your regular exercise sessions to increase your activity and decrease the time you spend sitting in a chair. NEAT, or non-exercise activity thermogenesis, is the amount of activity you do each day on top of your regular exercise sessions. Activities like grocery shopping, vacuuming, and parking your car farther away from the store entrance are all examples of calorie-burning activities that can increase your movement every day. Increasing these activities can help you lose weight, reduce your risk of long-term health problems, and get you out of your chair. Within 30 seconds, your body benefits from movement. It is worth it. Try wearing a pedometer each day to count the number of steps you take. Then each day, find ways to increase that number. Walk to the printer at work. Have a walking meeting with your coworkers. Pace while you talk on the phone.
8:30 sounds good.
All these steps
Thanks.
will add up to better health. A fitness tracker, usually worn on your wrist, can also help you see how much you are moving each day. And some fitness trackers can help you reach your individual health goals because they help track your exercise sessions as well as your NEAT movements to let you know how well you're doing overall. Here are a few more ways to increase your activity. Take the stairs instead of the elevator. Play with your grandsons. Put on music and dance while you do the dishes. Spend time gardening and pulling out weeds. Sit on an exercise ball at your desk. Be creative. Do what fits into your day and make it fun. Every 30 minutes, do something that makes your body move. You may want to try scheduling NEAT breaks into your day. Set an alarm on your phone or computer that tells you to get up and get moving. Sitting for long periods of time each day is not good for your health. Your body needs to be moving. Find ways every day to take energy breaks often. You will reach your health goals and feel better for the long term.
The information on this channel is intended to help empower heart and stroke patients to live healthier, longer lives. It is not a substitute for professional medical advice, diagnosis, or treatment. You should not alter or discontinue any treatment without first consulting your healthcare provider. Neither the Wellness Network, American Heart Association, American Stroke Association, nor this facility guarantee the accuracy of this channel's content and will not be liable for the use thereof. This channel may contain product advertisements. This facility or those associated with this channel do not endorse or have any financial interest in the advertised products.